Doctors, what's something you've had to tell a patient that you thought for sure was common knowledge? Vet here. I had this lady bring in her female cat who turned out to be pregnant. She was very adamant it was impossible, as this was strictly an indoor cat. Upon further questioning, she admitted that there was an intact Tom also living in the same house, but he couldn't possibly have done it. He was the female cat's brother. Yeah, cats don't work that way. Next story. Another vet here. Dead bodies decompose. If you leave your dead dog euthanized in the back of your car on the hottest day of the year, don't come crying to me when its belly fills with putrefying gases and bursts. Demanding I cover the cost of reupholstering your car might be considered a little rude as well. Next story. In a free medical clinic, I had to tell a mother that she should be brushing her 4-year-old's teeth for her. The daughter came because her throat hurt. After opening her mouth and using a tongue depressor to see her throat, the daughter squirmed like 4-year-olds are prone to do, and the tongue depressor hit her gums. Pus flowed everywhere, and the child wound up having to be put on penicillin before having every last tooth pulled due to severe infection. Alright, so I was a bit too hopeful about these not being so gross. I thought, oh, common sense questions, it'll just be patients not knowing things they should have. It'll be fine. No, it's medical stuff. Of course it's going to be disgusting. Oh, also totally just saw there was an edit, so gonna read that now. Edit. You should start brushing your infant's teeth as soon as they start teething and do a gentle gum massage with a baby toothbrush before that. Use safe-to-swallow toothpaste before the child is 10. Let the child brush their own teeth as soon as they're able for practice, and then have an adult brush them at a 45-degree angle towards the gums in small circles. Children should be supervised brushing their teeth until they're at least 12, or longer if necessary. This occurred in Nicaragua, quite far from any major city, and wasn't reported because the mother did follow-up and kept the appointment for extractions. The thought of brushing her daughter's teeth simply never arose. Before modern toothbrushes were invented, people used bones, porcupine quills, sticks, and chew sticks. The ancient Romans had toothbrushes as well. And yes, you should brush your pet's teeth. Pet toothpaste only, no fluoride. No, I didn't murder the mother. She was provided with 6 months worth of dental supplies for both of them and thoroughly educated on dental hygiene. Next story. I once had a patient with a cancer diagnosis completely depressed about not being able to see their family anymore. I was confused. I'd spoken with this individual's spouse and extended family who seemed supportive. There wasn't any indication of family problems, etc. It turns out that this individual thought that genetic and family history meant something similar to contagious, leading them to the conclusion that one should stay away from loved ones lest it be spread throughout the family. That was one clarification I was so happy to give. Edit. To those wondering how such a misunderstanding is possible, keep in mind, we ought not judge. Not everyone has the benefit of a good education, nor is everyone part of a generation and culture that has always had medicine and science in their lives. Other times, language and jargon can be a barrier to understanding. I was not the physician that failed to communicate the issues effectively, but we were all glad that at least this problem could easily be dealt with. Next story. Podiatrist buddy told me this one. Lady has to have foot amputated and is given waiver forms to sign pre-op. Buddy asks if she needs time to think about it. She's very nonchalant and doesn't seem to care much what they do. He gets suspicious and probes a bit as to why she's not more concerned. She says she gets that they have to operate and it's fine because the foot will grow back. He then has to explain she is not a salamander. Things get a bit more serious. Edit. This happened in Florida. The lady had to have the op done anyway, but yeah, doctors need legal training for just this reason. I wonder how this person came to that conclusion though, cause that's not just like a lack of knowledge thing, that is, quote, knowledge that had to be put there by something, right? Like, I find it hard to believe that someone would go through their life and naturally learn to believe that things grow back just on their own. Maybe she was just like, well, I've lost teeth and I've lost hair and both of those grow back, so, Next story. I remember watching some documentary once and there was this lady who had diabetes and her foot was necrotic. The doctor told her she was going to have it amputated, and she said, "No, Jesus will heal it for me," or something like that. The doctor looked at her and said, "Ma'am, you have bugs eating your foot. Jesus wants you to get it amputated." Next story. One of my professors told me this story from when he was treating patients in a women's clinic. Apparently, this woman was previously prescribed birth control pills, but still kept getting pregnant. She complained that she took her birth control every night and didn't know why it wasn't working. Finally, my professor found out she wasn't swallowing her birth control pills. She was putting them down there and thought that's how birth control pills work. No one ever thought they actually had to explain to her how to take the birth control. Next story. I used to work work for a small-town internal medicine/pediatrics office as a receptionist. We were closed for lunch for 2 hours, which in actuality was for our 2 doctors to get to the hospital and check on their patients, rounds. One day, one of the doctors didn't have any patients to check on, so he took a drug rep up on his offer for lunch and invited him in. I was working on a reorganization project for the files and decided to work through my lunch, so we were the only ones there. A guy came to the door who wasn't anyone I recognized. He knocked and asked me to let him in. I said, "Sorry, we open again at 1:30. He started crying. I ran to the door and asked what was wrong. He said, "I don't know," and pointed at the car. A woman was crying and hunched over in the front seat. I told him to keep her calm and ran back inside, grabbed the doc. He grabbed a wheelchair and we ran out to get her. The drug rep asked if I knew where the nurses kept supplies, and I got the key to their cabinet. When the doctor came in, he was visibly upset, but asked me to get our minor surgery bed ready immediately and asked for the nurse's key. Our drug rep said, "I'm in. What do you need, doctor? I'm a current licensed RN." He said some stuff and had me assist with getting the lady on the table. Drug rep started IV and had me hold the saline bag while he gave a dose of painkillers. Once he finished, my doctor told me to help undress the woman, and I asked her if she wanted the man in the room. She said yes, and I undressed her bottom half. As I did, I noticed her jeans were wet. My doctor noticed me and the liquid at the same time and said, "Use gloves." As I pulled off her jeans, we could tell there was a lot of blood. Doctor grabbed the saline bag and asked the drug rep to call an ambulance. As I finished pulling off her jeans, I noticed a protrusion from her underwear. The doctor noticed at the same time and said, "You have to talk to dispatch," and called for the rep. I explained the situation and they said, "Did he say live birth or abortion?" I yelled, "Birth or abortion?" Wow. I was stupid at 20. She freaked and her husband started crying. The doctor said, "Possible spontaneous or birth, likely spontaneous." I told them and started to hear the sirens. The rep met them at the door to explain, and it turns out she had her tubes tied 10 years prior in Mexico that didn't take. It turned out it was a stillborn at 28 weeks. She had no idea she was pregnant and had 4 kids already. They were devastated. She was already mostly there. The protrusion I saw was the head, so they had her deliver in our office before taking her to the hospital. As our staff came back from lunch, I met with them outside to explain why an ambulance and fire truck were there, telling them they could go home because we were closed for the day. I called our afternoon patients and rescheduled. The other doctor made house calls to anyone that he or they felt couldn't wait. It was awful, but it happens. And I hate it when people think that people are just so stupid for not knowing. This is an absolutely heartbreaking, tragic story, but how did this relate to the prompt? What in here was common sense? Or the last sentence made me think that OP was saying that people shouldn't think that people know certain things. I don't really get it. Anyway, an awful experience for the woman to go through. Next story. For almost a month, my friend had random pains. Bruises started showing up randomly. He looked ashen, and what we first thought was him being lazy was actually him not having any energy. Finally, his girlfriend got him to agree to go to the doctor, who sent him to the ER, where it took several doctors to figure out what was wrong, either because none of them had actually seen it in real life before, or they didn't think anyone could be that stupid. Quote the doctor, "You have scurvy. Eat a freaking orange." Next story. Not a doctor, but my ex-girlfriend had a severe peanut allergy, and one time she ate a Thai chicken pizza in the college cafeteria that didn't list peanuts as one of the ingredients. After her throat started burning, she knew something was wrong, so she grabbed a glass of milk, which I guess helped a bit, and went outside for some air, because she was having trouble breathing. A female security guard was passing outside in front of the building and saw she might need help. At this point, my ex was looking through her bag for her EpiPen. The security guard asked what was wrong, and she tried to explain she had a severe peanut allergy and needed to be taken to the hospital. When the security guard saw her take out the EpiPen, she took it from her and said it was school policy that she be the one to do it. She then asked my ex to hold out her arm so she could inject her. My girlfriend could not believe the security guard was trying to inject her arm like it was a flu shot, and out of frustration, she yanked it from the guard's hand and put it in her thigh. You know, like you're supposed to do, and sternly told her, "I need to get to a hospital now." Next story. I only went on a couple of dates with a girl who is a gynecologist. I got a text one day saying, "Oh my god, one of my patients is stupid. Their internal organs are prolapsing because they thought it would be a good idea to clean themselves with Listerine, all because they just banged unprotected and didn't want to get pregnant. What the hell?" So, yeah, don't clean yourself out with Listerine. Next story. My wife and I were trying to get pregnant, and due to possible complications, we were talking to an obstetrician. Towards the end of the visit, he tells us in all seriousness, "Just so you guys know, "You have to stop using rubbers if you want to get pregnant." We just stare at him a bit and say, yeah, obviously. And he just shakes his head and says, "You'd be surprised. There have been a few couples that really didn't realize that." Next story. My mom was a radiologist, retired now, and she regularly had to explain to patients that if you were too fat to be put in the scanner, you couldn't be put in the scanner. Along similar lines, if you weighed more than the table could support, it would be listed on a sign in big letters, "They could not put you on the table." Next story. So this happened when I was a family doctor. I got a call in the middle of the night. I was on call from a very distressed mother. She said her newborn was projectile vomiting with every feed. Projectile vomiting can be a worrisome finding in a newborn, so I asked her to meet me in the ER right away. When I saw the baby, he was smiling, happy, and in perfect good health. The mom assured me that he vomited with every feed, so I asked her to feed him to let me see what was happening. She did, and as soon as she finished, the baby started to fuss and then spit up the milk. I asked, was this what she had been seeing? It was. So I asked her if she ever burped the baby. She looked at me puzzled. She had no clue about burping. She thought it was some TV thing. I assured her it was real, and at 2 a.m. taught her how to burp a baby. I asked her to follow up with me in a day or two. She came in and said, "You are the best doctor ever. That burping thing you taught me is like magic. Now my baby is happy all the time." So there you go. Someone who didn't know about burping a baby. Next story. How a shorter/fatter 5 milliliter oral syringe held more volume than a skinnier and longer 1 milliliter oral syringe. How does this hold more liquid when it's shorter? Also, I've seen almost every incorrect way to use an inhaler, upside down being fairly common. People taking birth control pills only on the days they bang. So basically, I no longer assume anything is common knowledge. I'd rather someone be offended that I explain something basic than to have something awful happen because I assumed the patient knew something. Yeah, medicine definitely seems like that sort of field where you shouldn't assume your client, or patient in this case, knows anything. It's just risk for no reason. They should understand you are just trying to help. Next story. I used to perform fecal coliform counts on well water. Whenever someone in the county dug a new well, and periodically for existing wells, they were required to get a sample of their water tested to see how many colonies would grow on certain types of culture plates. The EPA wants a count of 0 for drinking water, so if they had counts, we would recommend certain actions. I remember a customer asking what TNTC meant on her report. I told her that's too numerous to count. Basically, the plate was covered in a lawn of fecal bacteria. Her next question. Could this be why my kid is always sick? Yes, it could be. Next story. A nursing home called a 911 for a patient who was having difficulty breathing. When we arrived, a PA was standing in front of the patient, vigorously fanning the old lady with her hands. She looked at us and said, "I'm giving her some oxygen because we couldn't find a portable O2 tank," and kept flapping her arms. Remember, this is a physician assistant, probably making $100,000 a year. I informed her she could stop now, and my partner and I did our best to wait until we were outside to start laughing. Next story. I'm not a doctor, but I'm an ER nurse. I had a patient come in for an STD check. She was very upset and continued to tell me that she only had one partner. Progressing through my assessment, she further divulged that even if he was sleeping with other people, it shouldn't matter because, quote, "he uses a rubber every time and he makes sure to wash it thoroughly after every use." I asked what she meant. When she said, "washes it thoroughly," she explained that he washed the rubber with hot water and soap before he used it again. I had to explain to her that rubbers are one-time use products. She had no clue. Next story. Here's my time to shine. So it's intern year of my surgery residency, and I was sent down to the ED to see a patient who may have a hernia. I went down to see the guy, and he looked like a John Denver lookalike with obvious psychosocial deficits who was sitting comfortably. I begin my usual line of questioning, and the guy lives by himself, has a girlfriend, and he had this pain in his groin for a few months now. So I begin a physical exam. And when I get to his inguinal region, there's obvious swelling with something hard in the canal. I then do a testicular exam and feel the guy only has one ball. Very rarely, people with inguinal hernias have their testicles retract in their inguinal canal. It can be dangerous if the blood supply is compromised. So I asked the guy, how long has he had only one ball? He looks at me like I'm crazy and says, "What do you mean? It's always been like this." I'm confused and try to rephrase the question, but the answer is the same. I'm so confused at this point and explain to him that he should have 2 testicles. He only has 1. He begins to argue with me and claims people have different amounts of testicles, and he was one of the ones with 1. At this point, he starts to develop an attitude, so I skip over it and schedule him for emergent surgery and speak to my attending. I'm the one who gets to scrub into the surgery, and I go to the pre-op area to meet my attending, and he's there talking to Uniball. Uniball and his girlfriend start pointing at me and getting heated with my attending. I approach them and ask what's going on. They start shouting that I tricked them into thinking there was something wrong with the dude's testicles, and I caused unnecessary worry. The attending and I had to explain to the dude and his girlfriend that the overwhelming majority of people have 2 testicles. It was abnormal to have just 1. They refused to believe us. So we end up taking him to the OR and pulling the hidden testicle out. Long story short, it was like a testicle diamond. It was rock hard and super compact. It looked like a super dense, hard oyster, just so you know. TLDR, I had to explain to a guy and his girlfriend that it was not normal to have anything but 2 testicles. They still don't believe me. 1. His testicle somehow retracted at some point in his life. 2. I'm assuming the girl wasn't with many guys in the past. 3. No, it wasn't viable. And 4. No, it didn't have cancer. Next story. Not a doctor, but a nutritionist. I work with a lot of different patients, and I have tons of stories about food stupidity. Had a lady have bariatric surgery. Your stomach gets surgically stapled smaller. Her mother kept trying to force her to eat real food the day of the surgery when she was on a liquid diet. She would eat it, puke, rip her stitches out, repeat. We had to ban the mother from seeing her because she would literally blackmail and guilt trip this poor lady into eating a whole pizza, barf it all up because her poor post-surgery stomach couldn't handle it, and end up ripping out stitches and causing enormous pain, all because her mother was positive she would die if she were on a liquid diet for a couple of days. Another lady I was seeing for clinicals was diabetic, and she would come in every week with stupid high blood sugar levels, 250 to 560-ish. She wouldn't know why they were so high. She kept a record of everything she ate, and all her food intake seemed fine. One day her husband came with her, which was weird, and he ninja slipped me a note while shaking my hand. It read, "Ask her about the Quick Trip slushies. She doesn't believe me that they have sugar in them." So I asked her if she was having any soda, lemonade, tea, ice cream, shakes, or slushies, and she told me like a light bulb had gone off in her head. "Well, I have been drinking about 3 of the 48-ounce Quick Trip slushies every day for a while now. They're just so good. And they aren't food or drink, they're slushies, so they don't have any sugar in them. I don't need to record them." It was hard to convince her that those are so full of sugar, it isn't even funny. But seriously, 3 a day on a type 2 diabetic? Oh, it was one of the stupidest things I've ever heard in my life. Next story. So my dad is a trauma anesthesiologist. My childhood was often colored by grisly stories of gunshot and stab wounds, terrible car accidents, and freak accidents. He worked in a trauma hospital in a city known for its crime. Not Detroit, but he kept busy. His favorite story, though, aside from giving anesthesia to a cow, is that a man once came in with big chunks of metal that had entered his skull just under the eyebrow. The dude was lucky he lived. Apparently, he'd been operating some dangerous machinery and it had blown up on him. However, when they pulled out the chunks from his head, on a few pieces they could make out the factory-printed words, "Always wear eye protection." If the dude was using his eye protection, you'd think nothing would be entering his head near the eyes. The fact it had the warning on the pieces that were implanted in his head is crazy. Just the universe being like, "Hey buddy, I gave you a free one, don't do it again." Next story. My dad was an OBGYN in Liverpool in the late 70s. He once had a couple come in to see him who were trying to get pregnant but were failing. Investigations proved that both had nothing wrong with them. So, they were invited in for a chat. He explained the results and the couple said they were banging regularly and couldn't understand why they weren't getting pregnant. Detecting a hint of stupidity, he asked how they went about doing the deed. He was putting his chicken in her belly button because that's where the baby needed to go. TLDR, Dad had to explain how to bang to 2 adults. Edit. Sadly, he didn't have the option of preventing them from contributing to the gene pool. That kind of thing gets you struck off. I don't think it's their fault they didn't know. I guarantee it's some schooling failure at that point. There is a little bit of a biological question of just, how you would have figured it out if we were not so advanced as a species. And, well, maybe they wouldn't. But hey, this is why proper sex ed is important, kids. Next story. Eye doctor here. I've got 2 main ones. First, when I ask them to follow a light as I move it around to check their eye movements. I'm asked, "With just one eye or both?" I really want to say, if you can do one eye at a time, I will be amazed. Second, the prescription cannot run out of your glasses. They don't need a refill. You didn't clean them too much and wash out some of the prescription. You just need new glasses. Next story. My mother, who worked as a pediatric nurse. She had a mother whose child was putting on a startling amount of weight. This was bad, since the patient's mother was obese and had diabetes, and they wanted to control weight gain for the baby. So they went through the feeding schedule. Baby was due for a bottle during the checkup. The mother whips out a bottle during appointment. My mother is startled to see the milk is bright freaking pink. She asks why the milk is bright goddamn pink. The child's mother explains that her kid prefers the milk if it has strawberry quick mixed in, and then he drinks more milk. The mom did not get the connection between quick and weight gain. Next story. Saw a show about super obese people a few years ago. One of the doctors said that one of his patients couldn't understand how he got so big, as he ate fruits and vegetables. The doctor had to point out that eating 30 bananas, 20 oranges, 40 apples, etc. a day will still make you fat. Next story. If you're Canadian, you probably remember the Sunday night sex show with the Dr. Sue Johansson. An adult male called in complaining about a horrible smell coming from his dong and how he thought it was some kind of infection. So Dr. Sue quizzes him on his self-hygiene, and after she mentions pulling back the foreskin when cleaning, the guy stops her, asking her to repeat what she just said. He had never learned how to properly clean himself and had never retracted his foreskin before because it hurt. It seems the foreskin had bonded itself to the glands. No, don't rush to the comments, I'll do it for you. Oh! You're welcome. Next story. I had an old lady come in with a massive bleed in her brain. She was pretty much gone. I had to explain to her tearful son that there was nothing we could do. He said that he loved his mama and he would give anything for her. So he asked us to give her his brain for a brain transplant. I was actually left speechless for a minute and then had to spend another 20 minutes explaining why that wasn't possible. Next story. My dad is a family doctor in the States. A woman came in for a well baby check with her 6-month-old, and she had what looked like chocolate milk in the baby's bottle. So he started explaining to her as kindly as he could that she shouldn't be giving her baby chocolate milk, at which point she interrupts him. She says, "Oh, that isn't chocolate milk, it's coffee. He just loves it." Next story. Not a doctor, RN in the ICU. I've seen some really stupid people over the years, but a few weeks ago, a patient's family got into a verbal altercation with me over the fact that I was trying to, quote, freeze his mother to death. He kept pointing to the digital thermostat displaying a temperature of 23 degrees Celsius. We are in the US. When I gently explained to him that 23 degrees Celsius isn't cold at all, he just kept pointing to the display and shouting, "You don't think 23 degrees is cold? It's 23 freaking degrees in here!" and acting insane. After multiple attempts to explain to him what Celsius is by myself, the charge nurse, house supervisor, and security, we finally gave up and had to escort him out. He was a man in at least his late 30s who graduated high school, and he had never heard of Celsius and Fahrenheit. He literally thought we were making it up in an attempt to conceal my efforts to freeze his intubated, critically ill mother to death. I'm willing to give him a little bit of a pass. Grief is gonna make your brain act weird, right? You're gonna have more brain farts than usual when tensions are high. That's just true. However, I do think it's more than likely that it wasn't that he'd never heard of Celsius and Fahrenheit, more so that it was just in one ear and out the other. Surely he has heard those terms in his life before. Next story. RN, not an MD, but here's the story. Patient was a newly diagnosed diabetic who needed to be taught how to inject insulin. So the diabetes educator did a good old routine of taking an orange, drawing up insulin, then injecting it into the orange, then made the patient repeat it. Patient goes home, etc., comes back in a week, and his blood sugar is out of control. They ask him if he's been taking his insulin, and he goes, "Of course." So they decide to ask him to demonstrate how he injects it. The patient goes, "Sure, I just need an orange." At this point, I started face-palming hard, because I know where this one's headed. But of course, they got him an orange and a vial of insulin with a syringe. So the guy draws up the insulin correctly, takes the syringe, injects it into the orange, and then says, "And then I eat the orange." At that point, I had to walk out because I nearly lost my crap right there. Next story. Honestly, you might be surprised that a lot of people know little to nothing about what a healthy lifestyle is in terms of a good diet and exercise. I've seen many patients who complain that they're overweight, which is a perfectly valid reason to go to your physician, by the way, but when I ask what they've done to lose weight, they say nothing. Or pick up smoking because that's what the fashion models do. Or drink soda instead of orange juice because orange juice is full of sugar. Yeah. If I were king, I would mandate every high schooler learn about these topics. Oh, and don't smoke in the same car as your child is in. Oh my God. Next story. I was working in a fertility clinic and I had a couple who had been trying to conceive for over 2 years. I asked all the usual questions. How often do you bang? Any previous pregnancies, etc., etc. Something seemed off to me during the consult, so I continued to ask questions. Finally, I asked if he finished while inserted in her. Both parties looked confused. Turns out the couple was not banging at all. I had to awkwardly explain to them how it worked. Diagrams were required. Next story. I'm a CNA at a nursing home. We got a new resident in and she had a huge bed sore near her tailbone region that had become infected and abscessed to the point you could probably fit a Coke can inside the opening. It had to be cleaned, packed, and have a wound pump attached to it every 12 hours. Turns out before she came to us, her family didn't think she needed any at-home help, so they would go over in the morning, get her up, bathed, dressed, and put a Pop-Tart on the table for her, get her in her wheelchair, and go about the day. She was incontinent and would sit in the chair for 12 to 15 hours, covered in her own urine and feces, until they came back, wiped her off, and put her back in her bed for the night. Sitting all day in your own filth, it turns out, leads to bed sores. The day she was admitted to my facility, her family, my administrator, and everyone were all talking in her room. They had introduced us and let her know I'd be taking care of her at night from now on. She whispered to me that she needed to go to the bathroom and I had to kick out my boss and her family because her son insisted that, quote, she can just hold it. She was never able to get over the raging infection in her wound and it eventually took her life. It was one of those situations where I really wish I could have looked them in the face and told them, you know you're the ones who did this, right? You ended her. Edit. Just as an update, yes, we tried to turn them in for elder abuse, but she was actually still of sound mind and realized what we were doing, and so she recanted her story and said she had never told us anything like that. She didn't want to see her son in jail for what he did to her, so she went to her death telling people things had just gotten out of hand and she was too weak. Next story. Ooh, I've got one. Inhaler technique. So we're told to always show a patient how to take an inhaler if they're new to them, and that we should check technique every so often. Yeah, you think, how hard can it be? Well, my senior once noticed that a patient was getting repeat prescriptions for an inhaler every week rather than every month. We brought her in to find out why. Oh, it just doesn't seem to work very well. I press it up to 50 times and it doesn't help. We were in shock over this. Salbutamol inhalers taken in excess, we're talking like 10 puffs taken in an asthma attack, can give you a thumping headache, a tremor, and a dry mouth. How is she taking 50 and not noticing? We asked to see the technique and yeah, turns out she was spraying it onto her chest. Internal face palms were had and we educated her on how to take it properly. Next story. Doctor here. Have had to explain countless times how aspirin, Tylenol, and Motrin are each different medicines that do different things. Also learned that most people have no idea what they're taking or how much. Edit with some fun facts about each medicine. Aspirin causes platelet inactivation and has some pain-relieving activity. Main risk with aspirin is bleeding in people with a predisposition, history of GI bleeding, etc. Tylenol, acetaminophen, has pain-relieving effect and reduces fever very effectively. Important thing for people to remember is that there's a risk of major liver toxicity, possibly deadly and irreversible. Different hospitals use different thresholds, but generally, safe doses under 3 grams per day. Also important to note that meds like Percocet are opiates mixed with acetaminophen, so again, there is risk of OD there. Motrin, ibuprofen, anti-inflammatory drug with pain-relieving properties. Major risks are stomach ulcers and kidney injury with high doses and prolonged use. Edit 2. This doesn't mean these are particularly dangerous to an otherwise healthy individual, but obviously, talk to your doctor before starting a new medicine. Next story. I was talking to a patient about an upcoming surgery and asked her, has anyone in your family ever had problems with anesthesia or being put to sleep for surgery? She said, yes! My mom died under anesthesia. This got my attention. I asked when did this happen, and she said, about 10 years ago. I asked a lot of other questions trying to get a handle on what had happened and how the events of her mother's death might relate to the risk of surgery for the daughter. Some complications run in families and others are unique to the individual or the illness. It's important to have a solid handle on that before the surgery. I finally asked, how old was your mother? She answered, "She's 65." I noted the present tense and asked, "Your mother was 65 when she died?" The patient answered, "No, my mom was about 55 when she died. She's 65 now." At this point, I laid my pen down and took a deep breath. Okay, so, your mother is not actually dead? It turns out that people love hearing "they died on the table" or "we lost you" or some variation of that. I have no idea who tells them or where it comes from, but I've never had a patient die who didn't stay dead. Had to explain to a patient the difference between dying and having your heart beat out of rhythm for a couple of seconds. I feel like it's one of those things. Everyone knows someone who has been, like, medically dead, right? I feel like I've heard these stories so much. I don't actually know the medical definition of dead, so maybe it's all, nothing. Maybe it's all lies. But I have heard this a lot. Next story. That vaccines are needed to help keep people and pets from getting terrible diseases and dying horrible deaths. Work at a vet clinic and a puppy was diagnosed with parvo, which FYI is a terrible disease that can be prevented with a vaccination. It ends the puppy by making them vomit and crap themselves to death, essentially, which is exactly what our blunt doctor told them. The owner said they didn't want to get the dog vaccinated before because they believed it would cause the dog to develop autism. They then left walking the dog out to our protests, spreading a highly contagious disease through a store filled with pets, including people bringing their puppies in, and called today to get some anti-nausea medicine so the dog could, quote, "get better and be back to his old self instead of sick, gross, and annoying." The doctor had to speak with them again on the phone and just basically short of yelling said, "Your puppy is dying. Anti-nausea meds will not fix him. Taking him to the specialty hospital and having him admitted may save his life. But since you keep yelling at me saying you have no money, then you need to take him to a shelter to be put to sleep so he doesn't die suffering because of your stupidity." Next story. That I can't give you a complete diagnosis or properly treat you without the proper diagnostic information. This includes radiographs. Why do people fear the minimal radiation it requires to take a damn X-ray to properly diagnose something? Yet, they're fine with Wi-Fi, cell phones, basking in the sun at high noon / all day, flying around the world, and whatever else, quote, could cause cancer. I feel like I'm taking crazy pills. Edit. My point wasn't that cell phones or Wi-Fi cause ionizing radiation or pose much threat. It's more along the lines of going against their misinformed perception of X-rays and their aversion to taking them. Radiation is bad, so I must not get X-rays. As others have stated, one panoramic X-ray for the jaw is equivalent to a cross-country flight in terms of radiation risk. The information acquired is valuable in making a diagnosis, and we don't zap patients indiscriminately or frequently enough to really pose a threat for cancer. Next story. Not doctor related, but common knowledge related. My dad works in railway maintenance, more so with level crossings in rural areas, ones that have a gate either side that have to be opened by hand. He has recently had to make an inquiry to his supervisors for new signs to be put up explaining how to cross the tracks safely after he saw a lady open the first gate, drive onto the middle of the tracks, get out to open the other side, close the first one, and drive out. Taking a total of about 3 minutes, her car was static on the track. It's like some people are born idiots. Next story. This is one of my favorite stories to tell. I work in dermatology, and once I had a precious little old man come into the office complaining of a new spot on his chest. Now, the spot wasn't itchy, painful, or bleeding, but he really wanted to check it out. This is fairly common. Most of the time, we look out for things like precancers and age-related spots in this age group. I had him lift up his shirt and show me the spot. I had a difficult time visualizing anything, so I asked him what spot he was referring to. He got a little testy with me and said, "What, are you blind? You don't see that spot right there?" I responded, "Show me," by taking my hand and placing it on the spot. What happened next still boggles my mind, but I'll never forget it. What I feel under my index finger is a squishy little lump. "Sir, that is your nipple." "My what?" "Nipples, sir. Everybody has these." Finally, he conceded with, "If you say so." I sent him home with the directions to just leave it alone, and then laughed so hard I dry heaved. TLDR, little old dude needed to be informed that he didn't need to fret because nipples. Next story. My grandmother was the ignorant one getting an explanation. She was 18 and in labor with her first child. She was the kind of lady to wear pants in the late 40s. The nurse looked her up and down and told her to put on the labor clothes. She took off her top and bra and got in bed. The nurse, really confused, "Take off your pants, too." "Why? It comes out my belly button, right?" asked Grandma. "No, darling, it comes out the way he came in." Next story. As a junior medical student on OBGYN, I was explaining tubal ligation to a patient and her significant other once. At one point he asked, "So you're gonna clip and burn the tubes, right?" "Yes, that's right." My next line was, "Although this occasionally fails, you should consider this permanent." All of a sudden he became visibly alarmed. "Wait, is permanent?" I didn't have much of a filter, so my response was a little blunt. "What part of clip and burn sounds temporary to you?" She didn't end up getting the surgery. Next story. 500 plus pound, 226 kg diabetic patient I kept running calls on when her blood glucose would go above 400. She would always say that she never eats any sugar and doesn't understand why this keeps happening. Found out she didn't know soda, syrup, gummy bears, candy bars, etc. all had sugar in them. By no sugar, she meant she had stopped putting spoonfuls of actual cane sugar on top of everything she ate. I tried explaining it to her, but she couldn't make the connection, or just didn't want to. I think the latter. Next story. After putting a few stitches in a middle-aged guy's scalp, the family asked if he was okay. The attending joked that his brain was still inside. The family were stunned by this news. I, the medical student, spent the next half hour informing the family that the brain was inside the skull and that a person couldn't live without one. They thought the brain was just a turn of phrase to reflect a person's common sense rather than an actual organ, sort of the same as what they thought about the heart. Next story. During paramedic school, my teacher was a PA who told us a story of a lady who came into the clinic he was working at. She said she didn't feel well. Nothing but general fatigue and not feeling right. He had the nurse do a standard set of vitals and a blood glucose. Her glucose was extremely high, so he goes in to talk to her. He asked, "Has anyone ever told you that you have diabetes?" She replied, "Yeah, a doctor said I had that once and I took some medication for a couple of weeks and felt better." He then had to explain to her that diabetes doesn't go away after some medication. Next story. I had the opposite happen to my wife. She was pregnant and had a thyroid nodule. We were concerned about how removal could affect the pregnancy due to changes in hormone levels and anesthetic during the surgery. We stated this concern quite clearly and in great detail. His response was that he would be operating on the neck and it was nowhere near the baby. Thanks for answering a question we never had. He was really pushing for surgery before delivery. We did not see him again. Next story. Pharmacist here. I have a couple of good ones off the top of my head. The first one. Patient comes in, she's upset. She's pregnant and doesn't understand why. She's on the pill. Upon talking to her at great length, I find out she only takes the pills on the days that she is active intimately. No other time. The other story is a related one. The same scenario, except patient comes in with her boyfriend. They are indignant as if I could have somehow prevented it. The problem this time, the pills were bothering the girl's stomach, so being a gallant boyfriend, he started to take them instead. Yep, these are all true. Sometimes the things you see in pharmacy make you fearful for the future of the human race, and I'm not exaggerating. These stories are just the tip of the iceberg. Next story. Not a doctor, but whilst working at a hospital doing some voluntary work, there was a patient who came into A&E with really bad abdomen pain. We took an x-ray and we found out he was really constipated. The guy didn't stop taking Imodium. This could be a brand name and not the actual medicine name. Basically, medication to stop you from having diarrhea. But he kept taking them after he'd stopped suffering symptoms. When we told him, he looked like we just offended his family or something. I think he was suffering an internal facepalm attack. Next story. I didn't know I was circumcised until I was 22 years old. I somehow got the impression that circumcision was the removal of the mushroom part because our dog had recently been neutered. I assumed circumcision was part of that process, and I had happened to see the dog's dong a few times and it was without a mushroom. One drunken evening, many years later, my friends and I were all in a discussion about various dong types. Girls were around also. We were all telling our own opinions and asking the girls theirs. Well, it slowly became apparent something was wrong. Girl. I prefer them cut with a nice mushroom. They just look nicer. The uncircumcised ones look weird with all that extra skin. Me. Wait. What do you mean you hate the extra skin of an uncircumcised dong? I'm not circumcised and I have no extra skin. Maybe I don't have as much? We pull out a laptop and look at pictures of what dongs really look like in various states, and I am in shock. I call my mom over to my room. Mom, was I circumcised when I was born? Yes, of course. My mind was blown for a few days. It was one of the last times I made assumptions so lightly, and the beginning of me having a much deeper need to investigate things more thoroughly. Don't you just love a story with a good moral? OP's now gonna do his research. But also, come on, brother, how did you not figure that one out? Once again, yet another point for sex ed. Next story. Someone I knew when I was doing my welding training was an ER nurse. I assumed stories like the one he told me were why he was switching careers. That and welders make serious cash. A guy came into the ER very paranoid and twitchy, but seeming otherwise alright, until he turned his back on one of the nursing staff and revealed a knife handle sticking out of his back. Someone had stabbed him in the back and left the knife there. The guy wouldn't believe it. He said his family made him go to the ER, but he thought they were crazy. Several doctors and nurses, even with a combination of mirrors, an x-ray, and pictures on camera phones, couldn't convince him he had a freaking knife sticking out of his back. He kept insisting they were trying to scam him. Even when he put his hand back there and felt the blood, he insisted they put it there, and it wasn't his. Eventually, they got him into surgery and removed the knife, but for a good hour, they had at least 10 people trying to convince this guy that, yeah, he did indeed have a knife in him. You'd think, sir, you have a goddamn knife in your back. Wouldn't need much more explanation than that, but this guy, it took some convincing. Next story, reverse. Just a few months ago, I went to the doctor explaining how I had shortness of breath and my hands kept shaking while I was away on an important business trip. I thought I may have been having a stroke based on my WebMD diagnosis. Doctor explained to me that I may have been having a panic attack. I genuinely didn't know that was a real medical condition. Apparently, some folks, even those who don't suffer from regular anxiety bouts, can suffer a panic attack hours after high-stress situations, and it just hits you at the most inopportune times. Next story. On the flip side, I went to the doctors a few months ago to get treated for strep. I was still on birth control at the time and casually confirmed that the antibiotics will indeed mess with my birth control. The doctor, a young guy, imminently assured me that it would not. I am more alert at this point and was like, yeah, it'll mess with it, as do all antibiotics. He said that was wrong. I told him he was wrong. Doctor stands up, pokes his head out the door, and yells to the female nurse down the hall. Hey, do antibiotics hinder birth control medication? I hear mumbling. He closes the door, sits back down in front of me, and says that this is the first time he has ever heard this. And yes, sorry, it will indeed mess with my birth control. Next story. This is especially important for all those who are considering natural treatments and seeking naturopaths for treatment as opposed to a physician's consultation. I've had many questions regarding natural alternatives, but this case stood out to me. I had a 22-year-old female patient come into my OB rotation during my third year medical school with symptoms that pointed toward a yeast infection, bacterial vaginosis, but most likely a urinary tract infection secondary to an STD. No history of STD, but a recent skid with multiple partners and unprotected encounters. Urine sample taken along with blood work. Tests were positive for chlamydia/gonorrhea. Simple antibiotic treatment. Standard of care is azithromycin, 4 pills plus Supra, which is a dose of 1 pill. Instead, she elected to refuse the medicine and told me she would be using garlic, as that's what her naturopath recommended. Despite adamant attempts to convince otherwise, she declined. Fast forward 7 months. I am now in my emergency rotation and the same patient comes in when I happen to be working. Fever, tachy, intense, sharp, stabbing right lower quadrant pain. Pregnancy test positive. Patient is diagnosed with pelvic inflammatory disease, most commonly secondary to untreated G/C. Further imaging supports an ectopic pregnancy. Future fetus implanted in the wrong spot in the female reproductive system. Ectopic is also common secondary to PID. Having PID, fallopian scarring, ectopic pregnancy, and a near-death experience was worth taking this natural route when a simple antibiotic solution could have avoided this? I would argue against that. Natural products have their place, but your doctor is likely aware of natural alternatives where they're warranted. Discuss them. To be clear, her case was a 99% avoidable with the use of simple antibiotics. Have a similar story with a patient who declined pneumococcal vaccines for her children because of all that alternative media mishype. Her son got into an accident, had his spleen removed, to which she still declined the vaccine. Child developed meningitis 6 to 8 months after that occurred. Survived, but again, avoidable. Moral: if you're going to educate yourself with information online, use credible sources, especially those that don't completely discount an accepted, tried and true expert, or at least someone who is absolutely qualified to give an accurate response/POV. Narrator's commentary. I don't understand going 100% down the naturopath route. I definitely believe natural remedies and natural treatments for things exist. I think there are quite a few of them even. But as OP said, I also think that doctors know when they're a viable option. At least most of the time. They're not going to get it right every time, sure, it's not their field of expertise necessarily. But hey, it's close enough. I feel like listening to a doctor is probably better. Next story. I work in a hospital lab. Quite a few years ago, there was a patient who was on our schedule for an analysis from one of our fertility docs. The between the lines here is that the patient was having some fertility problems. Patient presents with a cup of urine. We explained that we needed a semen sample, not a urine one. Confused why his first sample was rejected, he goes back to the private bathroom at the end of the hall. About an hour later, he comes back with another urine sample, and that's when I literally had to have both a birds and bees talk with a man in his mid-30s and clue him in on the world of self-pleasuring. This actually happened twice in my 8 years, and I found out about another guy when I was talking to my manager about it. The second time I had a few thoughts. I could save these guys thousands of dollars by explaining how to bang properly. Somehow it never came up in the office that the wrong fluid was being used. And the wives of these guys are totally okay with being peed into, I guess. Next story. What a hip is. As a resident rotating through orthopedics, I had this elderly lady come in saying she had pain in her bender. What do you mean your bender?
You know, your bender. What do you use for bending?
Do you mean your hip?
What's a hip?
I point to her hip.
Yeah, that part. You know, your bender. You use it for bending. You don't know what a bender is?
She looks at me like I'm an idiot. Next story. Alright, now for the old switcheroo. My ex-mother-in-law was a pediatrician. However, her education was all from the 60s and 70s in Cold War Poland, and she hadn't practiced as a pediatrician for 30 years when our daughter was born. Like a lot of first-time parents, we read all of the books, and the vast consensus at the time was that the only thing babies need is mother's milk. So we set ourselves up for that, and the baby is thriving after a couple of weeks with our doctor telling us everything's good. Mother-in-law comes to visit, and of course, we're doing everything wrong. We can't hold the baby right. We're being too attentive. We're not being attentive enough. She's too warm. She's too cold. I think you expect a certain amount of that, but then she starts insisting on giving the baby sugared black tea in a bottle. I'm not the smartest guy on the planet, but I'm smart enough to let the wife and her mom settle this between them. Lots of screaming back and forth. Showed her the literature from our doctor about nursing, all of the references in the baby books, pulled down a couple of recent research articles, but the crazy old battle axe didn't give up. Finally, I caught her after we foolishly left her alone with the baby for a couple of minutes, trying to force her to take a bottle with tea in it. She yelled at my wife, saying,
"In a week I'll go back home and then you can do whatever you want with the baby."
In a level voice, I told her, "That's what you don't seem to understand. We can do whatever we want with the baby right now." Next story. Patient advocate in a busy OR in NYC here. Certain immigrant populations are unaware that they're supposed to report to a care provider if they're suffering in any way. They either would do so to save face, thought that we had the tools to electronically measure what they felt, or didn't want to burden the care provider. So, in other words, they were so respectful/nice, they would sit in the recovery room with high pain scores for hours, and no one even knew they were suffering. This isn't due to simply a language barrier. These patients entered the hospital with a different definition of good patient from ours, and most care providers and patients were oblivious to this discrepancy. If you feel sick after an operation, don't hide it. The burden of knowing that you are suffering far outweighs the burden of providing the care that you need. Next story. From the other end of the spectrum, I went to visit my doctor one time because after 4 years of trying, I could not get pregnant. My doctor did an ultrasound and a few days later was explaining to me that they saw lots of follicles. I had to ask her what a follicle was. I know what it is in relation to my hair, but I didn't think there were hairs in my uterus or whatever. It turns out that a follicle is like an unreleased egg or something. She made me feel dumb. It was the look on her face when I asked. Now, granted, I don't have these parts of me, but I didn't know what a follicle was either. OP, you're not dumb. The fact that a doctor would make you feel dumb for something like that is just disrespectful. Next story. Well, it's not just a one-timer. I got those a few times. About 2 years ago, I was working as an intern in OBGYN ER in a little hospital near where I live. Just to put things in perspective, I live in France, and the town where this hospital is located is inhabited by a majority of migrant families. Immigration in this town started at the beginning of the 20th century and is still strongly going on. It is also, as many cities of this type, globally poor, though some parts are really rich. Anyway, thing is, most of these families are from Arab origin, and sexuality isn't the craziest topic to be discussed at dinner in some of those families. It ended up bringing a few funny moments I would like to share. I saw a girl in her 20s and her mother once who came because she puked a lot and was bleeding from down there. Turns out, she's pregnant. Right when I announced it, both the mother and the daughter yelled at me.
"That's impossible, we're both on the pill."
I then answered, well, contraception is never 100%, particularly if you sometimes forget your pill. Did it ever happen? Do you often forget to take the pill every day? Then the mother answered me,
"No, we never forget. I take it on even days, she takes it on odd days. We never forget."
And then it took me around 40 minutes to explain how contraception worked. Another time, a young girl came in. I diagnosed her with candidal vulvovaginitis. Wikipedia tells me it's commonly called vaginal thrush. When I wrote the medical exam in her medical file, I noticed it was the 6th time in 8 months she'd come for the very same reason. I found it awkward and decided to investigate a bit. She explained to me that since the first time she had contracted it, she was being very hygienic. I asked for details, and she told me every morning she used a dong-shaped showerhead to wash the inside of herself, and then brushed the inside with soap and those bottle brushes we use to clean baby bottles. Had to explain the whole concept of vaginal flora balance and everything. And third one, a short one. I wasn't in the ER, I was with one of the seniors doing regular consultations. A 50-ish woman comes in. She used to be followed by the MD I was helping. We examine her, check her breasts, do her smear. Right before we end the appointment, she asks, half startled and half angry,
"Dr. B, I don't understand. I'm in my 50s now. Why don't you check me for prostate cancer?"
I couldn't help but laugh at that one. I mean, I kinda get it. At that age, cancer is probably at the forefront of your mind, and you read all these things. It's like, well, if you're this age, you should be worried about these cancers and these things developing and everything. I guess she just missed the part where it said if you're this age and biologically male, then you should. Anyway, a harmless mistake. And that is our last story for today. I would like to thank you all so much for watching. I have a feeling this thread was at least a bit educational for some of us, so hey, you're learning on YouTube, kids, look at that. Anyway, thank you for watching. I hope you have a wonderful day or night wherever you are, and I will see you in the next one.